Welcome back to Talk the Walk with me, Sarah Wong. I'm with Anthony Wu. He's the Sunrise Diagnostic Center Chairman and CPPCC Standing Committee member. He is also the former chairman of the Hospital Authority. Thank you very much, sir, for your time.
My honor.
Now, I heard that there's reports suggesting there will be district-style lockdown in Hong Kong. I know that the chief executive has ruled out a citywide lockdown, but do you think a trade and finance hub like Hong Kong can survive any sort of mainland-style lockdown if the COVID situation continues to spiral out of control?
I think sometimes, the word lockdown, citywide lockdown, I think if you look at the mainland, that there was only one city that was locked down, that's Wuhan. And in all other places, it's really they lock down very small areas when they adopt this dynamic zero COVID strategy. So Hong Kong, we are a city, and we can do a few things, but I don't think that we do need a full city lockdown for a prolonged time period. What we could do is bigger districts, bigger areas, or bigger housing estates and whatever. With the testing capacity, we can actually do it quite quick. But as we mentioned at the earlier, that isolation facilities is important if we could do a big scale testing.
Now, we know that Hong Kong, it's like you say, yes, we are a Chinese city, but we're fundamentally different. For example, we have high population density. We heavily rely on imports for our food and necessities. We have thousands of cases a day, and we have an aging population among which vaccination rates is very, very low. So, sir, I know that you represent Hong Kong in China's People's Political Consultative Conference. Do you think the central government understand what Hong Kong's situation needs right now, or it is simply trying to duplicate what's worked in the mainland and bring it to the SAR?
I think the central government fully understands the Hong Kong situation. If you look at President Xi's words, what he's saying is this is something that we have to fight the Omicron together. But the leader is the Hong Kong government because we understand the situation better. So if you read his words, Hong Kong is the leading party in the whole strategy with the support from different ministries and different provinces in the mainland. Of course, Hong Kong is very different from the mainland, but there are certain lessons that we can learn from the mainland, the way that they fight COVID. They're very precise, very precision testing. Again, if one city or one area has a problem, there are a lot of other provinces, cities who go to help them. And Hong Kong, we do need help from other places. If you cast your mind back to 2020, when Wuhan has had this big problem, 30-something provinces all sent a medical team with equipment, with MRI, CT, all went to Wuhan to help. And this is what we are needing right now. Is Hong Kong is a small city. We only have 7 million people. The mainland is big, 1.3, close to 1.4 billion people. So for them to help us, it's very easy. They send a team of 1,000, 2,000 to help us. But we need to do it fast.
Because we've seen devastating scenes this few days in the recent
It's really very sad seeing those scenes, really.
Patients were on the streets waiting for beds because there's simply not enough in the hospital. We know that the Omicron variant was first reported in South Africa in November. Despite Health Chief Sophia Chen's promise in late December that the SAR is ready for the worst, we've seen a city ill-prepared simply for a large-scale outbreak since the onset of the fifth COVID wave. This is 2022 in Hong Kong. What do you think that's gone wrong, and how do we fix it?
First of all, I think that nobody expects Omicron to sort of transmit so fast, especially with BA1 and BA2. BA2 is even faster than BA1, one of the two strains. So I think it is really hitting Hong Kong with unexpected speed. And secondly, I think it's really testing capacity and isolation facilities because we have been doing quite well in 2021. So we may be slightly complacent that, oh, we can cope, but not knowing the speed that Omicron is transmitting. I think what we need to do now is really, as I said, two simple things, not too simple, two major things that we need to do: increase the test capacity and increase the isolation facilities. These are the two main things that we need to enhance as soon as possible.
What about the capacity of hospital? You said that we need more testing capacities, which is true, but what about those who are admitted to the hospital and simply do not have beds to lie on?
Okay, I think we need to sort of triage. I mean, those are elderly, those have chronic diseases, who have major symptoms, then they should be admitted. But for those who have no symptoms or very light symptoms, they could be sent to like Penny Bay or some other isolation facilities, and I'm sure they can recover quite quick. That's what we have seen in other parts of the world. If you have Omicron, you stay home for 7 days, and you do one more rapid test, and you're okay. And I think there's a lesson to be learned is, okay, but you do need to isolate. There is no question. Unlike other countries or cities, we need to isolate, and that is why we need desperately to find more isolation facilities at this moment in time.
Now, also overwhelmed by Omicron is South Korea. That's something I think similar to what you've touched on before. They have now shifted to a select and focused strategy to mainly focus on the highly vulnerable population like the elderly and those high-risk population. Do you think it's time for Hong Kong to acknowledge that this is a harsh reality that we're destined to face? We need to focus our resource on the highly vulnerable and maybe, just loosen up a bit with the young and fit population?
I think what we should do is focus on the more vulnerable, the elderly and the children. And if they have got Omicron, then admit them to hospitals. But for the sort of the younger the younger people that has no symptoms or very light symptoms, it's usually to send them to I call the isolation facilities. So first of all, medical services directly to those that need them, and then for a vast majority of the Omicron carriers, we can send them to isolation facilities.
Do you think the current hospital authority has enough capacity, has enough manpower that can keep up with this dynamic zero strategy in Hong Kong?
I think two things. One is because, as I said, Omicron, a lot, maybe 90 or 90+%, that doesn't need to be hospitalized. They can be sent to isolation facilities that need really the daily help, but you don't really need a lot of doctors and nurses to look after them. But if you look at Hong Kong, we only have 30,000 beds in hospital authority and the private sector. So we simply don't have enough beds to accommodate for everyone to go into hospital. That's why we need to focus our hospital resources to those that are really in need of hospitalization, and send the others to Penny Bay or other facilities that we need to find desperately to accommodate those, and to leave those infected carriers in the community is not a wise thing, because I'm sure we will see the 5 digits confirmed cases in no time. And if you continue to leave those infected cases in the community, that figure is going to soar up.
Yeah. Sir, I know that, as I mentioned, you're the former chairman of the hospital authority, and I understand that you may not be in a position to comment on the current HA management and administration, but I would be remiss if I didn't ask what you'd have done to alleviate the devastation we're seeing every day in public hospitals right now. Shall you be in charge?
Very difficult questions to answer, but I think I'm sure that hospital authority is doing everything it can to cope with the situation. And I think one thing that we should all do in Hong Kong is really to get the private sector to help in coping with looking at some of the patients. In
what
Hong
can
Kong,
private sector do to help?
Oh, a lot of doctors can come and help. If you look at Hong Kong, hospital beds, 90% of the beds are in the public sector, only 10% in private sector. But for doctors, it's 50-50. So I'm sure the other 50% of the private doctors can help HA to look after some of the patients, to help with the triage, to help with the sort of lighter cases or the asymptomatic patients.
If the government actively soliciting the help from the private sectors to lend a hand to the crumbling public health systems?
I think both the government and the hospital authority are working on it. But again, I'm not. I don't know what is happening.
Okay.
What was the negotiation between them?
Understood. Now, the last question I have for you is about confidence in the government. We know that for a city's pandemic strategy to work, policies need to be followed and guidance needs to be listened, right? And I'm afraid that's becoming less and less the case in Hong Kong, where confidence in the government's competence has taken the heaviest blow yet. And I wonder, where do we go from here?
Where do we go from here? I think we really need to sort of fight Omicron hand in hand, shoulder to shoulder, because this is really almost getting out of hand. And I think it's not to put the blame on anyone, but every one of us should follow the government's guidance on working from home, less gathering and whatever, and then try to fight this COVID together. And
Okay,
I'm sure
well,
with the help
yes.
from the central government that we will win at the end of the day.
All right. Pleasure talking to you, sir. Thank you very much, as always, sharing your expertise and your experience with us. Thank you for your time.
Thank you, Sarah.
I'll talk to what will be back next Saturday on HKIBC. Stay tuned.